Hello, my name is Dr. Richard Artymowicz, and I'm the Director of Pharmacy Services here at Cape Regional Health System. Do you know that nearly 100% of patients in the hospital receive a medication during their stay? Medications play a central role in the management of most diseases, but medications can also cause side effects or may not work as well if they're not taken exactly as prescribed. That said, it's very important for us to make sure that our patients are well informed about the medications that they receive. For the next several minutes, members of our pharmacy staff will introduce you to many of the medications that we use here in the hospital, some of which you may already be receiving. So, let's get started.
Hi, my name is Bev Poltorak. I'm one of the clinical pharmacists here at Cape Regional Medical Center, and I'm going to talk to you about a group of medications called beta blockers. Beta blockers are medications that we often start in the hospital, especially if you are visiting our progressive care unit on the 3rd floor. The most common uses for beta blockers are for high blood pressure and irregular rapid heartbeat called atrial fibrillation or AFib, and heart failure. Sometimes we even use beta blockers before and after surgery to prevent heart problems that could be related to the surgery. Your doctor and nurse will tell you the specific reason for your beta blocker therapy. And here's a list of some of the most popular beta blocker medications. The benefits from beta blockers come from their ability to lower heart rate and blood pressure. So most of the important side effects from these medications are also related to these actions. These drugs can make you feel tired, they can cause cold hands, headache, upset stomach, and dizziness. If you have diabetes or asthma, we need to be careful with how we use beta blockers. Beta blockers can interfere with your asthma medications or make it more difficult to tell if you're having a low blood sugar reaction. If you have diabetes or asthma, please be sure to tell your doctor, nurse, or a pharmacist. Once you start taking a beta blocker, you should not abruptly stop taking it. This could result in rebound side effects like a fast heart rate or even tremors. And now I'm going to introduce Dr. Marissa McAndrew, and she's going to talk to you about our next category, pain medications. Thank you.
Hi, my name is Marissa McAndrew, and I'm the pharmacy resident here at Cape Regional Medical Center. I'm going to talk to you about pain medications. Whether it's an over-the-counter pain reliever for a headache or a strong narcotic for surgical pain, most patients in the hospital will require some type of pain medication during their hospital stay. These pain medications will help relieve some of your pain, but may not always make you pain-free. It is important to talk with your nurse and doctor to set your pain goal on a scale of 1 to 10 so you know what results to expect when you get your pain medications. If you have mild pain or a headache, you may just need an over-the-counter medication such as one of these. Acetaminophen, which is sold as the brand Tylenol, is effective against fever and mild pain from conditions like headaches or muscle aches. You should always read the label on your medication bottles because combination cough and cold medications might also contain acetaminophen. And you should not take more than 3,000 milligrams or 3 grams of acetaminophen in one day. Ibuprofen, which is known as Motrin and Advil, is similar to acetaminophen in that it can help decrease fever and mild pain, but it also can reduce inflammation. Ibuprofen is part of a drug class called non-steroidal anti-inflammatory, or NSAIDs for short. NSAIDs can be useful for conditions that involve inflammation such as swollen joints from arthritis or a sprained ankle, but they can irritate your stomach, so you'll need to take it with food. Ibuprofen and other NSAIDs have been linked to greater risk of heart attacks and strokes, so people with heart disease should use extra caution when using these medications on a regular basis. More powerful pain relievers are often used after surgery or if your pain is more severe. Here are some of the more common medications used. These medications carry the risk of addiction, so you should take them exactly as directed. Powerful pain relievers may have an interaction with other medications, especially those for depression, anxiety, and insomnia, and also with alcohol. These drug interactions could interfere with your ability to breathe properly during sleep or could cause an overdose. You should only take other medications with strong pain relievers after talking with a healthcare professional. The most common side effects for pain medications include constipation, nausea, vomiting, and being tired or drowsy. These medications may also impair your awareness and could negatively affect your ability to drive or work safely. Now, Dr. Huff will talk to you about antibiotics.
Hi, my name is Chris Huff. I'm a clinical pharmacist at Cape Regional Medical Center, and I'm going to talk to you about antibiotics. Antibiotics are medications often given as IVs in the hospital for infections. Antibiotics will help you kill or stop the growth of bacteria in your body, and different antibiotics work against different types of bacteria. Your doctor and nurse will tell you what sort of infection your antibiotic therapy is for. Here is a list for some of the most commonly used antibiotics. Antibiotics can make you nauseous, have diarrhea, sensitivity to the sun, or cause muscle pain. If you get a rash, hives, or start to have trouble breathing, you may have an allergic reaction to the antibiotic and should be seen by your doctor immediately. You may be switched from an IV antibiotic to a pill when you start to get better. Make sure you are aware of the instructions for your antibiotic, as some pills should be taken with food and others should be taken on an empty stomach. You should also avoid alcohol when you are taking antibiotics. It is important to finish the entire course of antibiotic therapy to get rid of all the bacteria. If you don't take your antibiotic as directed, the bacteria can come back stronger and harder to get rid of next time you have an infection.
Hi, it's Bev again, and now I'm going to spend a few minutes talking to you about a group of medications called ACE inhibitors. ACE inhibitors are medications that we often start in the hospital, again, especially if you are visiting our progressive care unit on the 3rd floor, because, like beta blockers, these medications are useful for many things. The most common uses for ACE inhibitors are for high blood pressure, heart failure, or if you've had a heart attack. Your doctor and nurse will tell you the specific reason for your ACE inhibitor therapy. Here's a list again of some of the most popular ACE inhibitor medications. The benefits from ACE inhibitors come from their ability to relax the blood vessels and lower your blood pressure. So, most of the important side effects from these medications are related to these actions. These drugs can make you cough, feel dizzy, or feel like you could faint. Be careful when you get out of bed, or be careful not to get up too quickly, or ask for help so that you don't fall. ACE inhibitors could worsen any existing kidney problems or increase your potassium too much. If you do have kidney problems or high potassium levels, make sure to tell your doctor, nurse, or a pharmacist. Once you start taking an ACE inhibitor, you should definitely have your blood pressure checked regularly. And remember, at any time, if you have any questions at all about any of your medications, always ask your doctor or pharmacist.
Hi, I hope that you're not feeling overwhelmed by this information. There's just a few more groups of medications that we want to make sure you know about. The next group of medications we will cover are diuretics, which some people call water pills. The most common uses for diuretics are for high blood pressure, heart failure, lung congestion, or fluid retention. Your doctor and nurse will tell you the specific reason for your water pill. Here's a list of common diuretic medications. The benefits from diuretics come from their ability to remove excess salt and water from your body by increasing the amount of urine you make. These drugs can make you dizzy, increase your urge to urinate, and lower your potassium levels. If you have gout, make sure to tell your doctor, nurse, or pharmacist because diuretics could trigger your gout to flare up. Remember, the more powerful loop diuretics like Lasix can really increase your volume and frequency of urination. So if you take these pills twice a day, take the second pill around dinner time so you don't have to get out of bed and use the bathroom.
Hi, The group of drugs I'm telling you about now are called corticosteroids, or steroids for short. These steroids are different from the anabolic steroids, or the steroids that you sometimes hear about athletes abusing. Steroids are medications that we often give in the hospital because these medications are useful for many inflammatory or allergic reactions. The most common use of steroids are for asthma, COPD, skin conditions, irritable bowel syndrome, and rheumatoid arthritis. Sometimes we even use steroids to prevent an allergic reaction before certain medications are given. Your doctor or nurse will tell you what specific reason why you are given a steroid. Here's a list of some of the most commonly used steroids. The benefits from steroids come from their ability to reduce the amount of inflammation in your body by suppressing the inflammatory mediators like cytokines, histamines, and cyclooxygenase. So most of the important side effects from these medications are related to these actions. These drugs can make you have nauseous, restlessness, or have insomnia. You should also take these medications with food to decrease the risk of upset stomach. If you have diabetes, be sure to tell your doctor, nurse, or pharmacist. Steroids may increase the blood sugar and should be checked regularly. If you take steroids for a long duration, you should not stop taking them abruptly. You may need to taper your steroid dose, meaning you take a smaller amount every day to prevent rebound side effects like nausea and fatigue.
Hi, now let's wrap up by talking about a group of medications called anticoagulants or blood thinners. Anticoagulants are medications that we often start in the hospital to prevent any at-risk patients from developing a blood clot. You're more at risk of forming a blood clot if you are not moving as much while you're in the hospital, if you've suffered an injury, or if you have had surgery. If your doctor decides you may be at risk for having a blood clot while you're in the hospital, you may be on a blood thinner such as heparin, Lovenox, or Arixtra. The benefits from anticoagulants comes from their ability to make your blood thinner, which means that it takes longer for your blood to clot. So most of the side effects from these medications will have to do with minor bleeding. Since these medications may increase bleeding, look out for easy bruising or bruises that keep getting bigger, prolonged bleeding from your nose, wet-looking coffee grounds if you throw up, bleeding from your gums when brushing your teeth, dark tarry stools, or visible red blood in the toilet when you void. These blood thinners are given as shots in your belly and should be administered in a different spot each time. You may have some bruising where your shot was given. Now there are several other blood thinners that can be given as pills if you actually do develop a blood clot. If that should happen, a pharmacist will come up to your room and we will sit down and talk with you about that and answer any questions you have. Thank you.
Thank you, Bev, Marissa, and Chris. I hope that this brief introduction to medications has given you a better understanding of the medications that you're taking here in the hospital, especially any new medications that may have been started during your admission. If you're taking a medication that we didn't talk about, or if you have more questions about the ones we did, let your nurse know and a pharmacist can come in and answer your questions. From everyone in the Department of Pharmacy Services, we hope that you feel better soon, and thank you for choosing Cape Regional Health System.